I am Dr. Fouad Ghaly, and I'm interested in regenerative medicine. That is the most important thing to keep us healthy and well. Not only this, but increase our longevity with a greater quality of life. The word EECP means external enhanced counterpulsation. Why do we call it counterpulsation? Because the heart pulsate, and this is the counterpulsation. So it counters the action when the heart is relaxed. The blood volume in the human body, 60% of it is in the lower half. So we utilize that volume in the lower half, which is 60%, to pump it back into the rest of the body. Basically, it is approved and reimbursable by Medicare and FDA and all that for heart disease patients with angina. Actually, it reverses angina 3 and angina 4, make them to 0 angina or maybe class 2 angina, according to the Canadian classification of coronary artery disease. But I started doing that on completely healthy patients or apparently healthy patients, because the heart is in a closed box. No matter how sophisticated diagnostic tools we have, we could have what you call a false negative, in a sense that you might have a clean bill of health, but nonetheless you go out and you keel over and have a heart attack. And the example of that is Tim Russer, for example, in NBC, and he had a complete physical, and they told him you have a clean bill of health, as well as our president Bill Clinton. He finished his presidency in 2000, and in 2004 he had massive heart attack. And what does that tell you? The president has the means and his ability and at his disposal to have the best presidential medical care, physical examination, all the tests were done. Nonetheless, they missed the fact that he had coronary. The heart disease didn't develop in only 4 years, because heart disease has the history to develop so silently and evasively for over 15, 20 years before it rears its ugly head. So that's my point. So if I took somebody who's an executive, for example, or in highly stressed situation, now when we put on this, we guarantee and we actually make this way, we generate new blood vessels in the heart that he was not born with. Say you have partial occlusion, but it's not giving you any chest pain. So why don't we generate a new channel of contributing channel to your the blood perfusion of your heart muscle? Well, this machine doesn't only do that, but it increases the blood flow to the carotid. That means it increases the blood flow to the brain, and it's all documented. It's not hocus pocus. I lectured all over the world. You know, I lectured in Vienna, in London, in Milan, in Munich. I have a machine that I put in Munich. They have done research and published it. I lectured in Beijing, China, Hong Kong, Taiwan, Thailand. I mean, I've lectured on this device. So I was the earliest one to use it here in Southern California. Now there are 2 machines now present at Scripps Institute in La Jolla, and there are another 2 or 3 machines in UC San Francisco, and there are some machines in the Mayo Clinic, and so on and so forth. But unfortunately, it's not being widely used, and it's only a few people that really know the benefits of it. And I would like to make sure that this knowledge get to be introduced to the public at large for people to know that such a thing exists.